and your professional degree.
I'm a doctor of veterinary medicine. I was referred here by a friend of mine, Jennifer Logan, who's also a medical doctor in the human medical genre. And basically my only experience with chiropractics before this was working a little bit with animals. And then I had seen one other chiropractor who had refused to see me because apparently he thought that I had too much damage. He couldn't really do anything for me at that point.
Okay, and then so when you came into the office, what was your initial, couple of visits about, and then what you ended up learning?
Well, I think this is back in November, if that's correct. Yeah, back in November of 2010.
Is it November?
Yeah, I know, a long time ago already. But basically I'd been doing some landscaping. I was moving around a bunch of railroad ties, and I thought I had just pulled a muscle in my neck. And I was on a volleyball team with Jennifer, and I had to miss a couple of games, and had spent 2, 3, and then finally 4 weeks solid on a heating pad, miserable, tossing and turning, not sleeping at night, never smiling. That was another one.
Yeah.
Hardly able to walk, hardly able to drive, hardly able to spend any time with my dog, worried that I wasn't going to be able to cook for myself or like take care of my house or anything. So she talked to me about a chiropractic office that she was going to, that she had seen some results. And so I gave it a try, and that's how I got here.
Okay. So then what was wrong with your neck, and what did I tell you, Dr. Martin tell you?
Well, this is the first office that forced me to do x-rays, and I thank God for that, because actually the x-rays showed that I did have not muscle damage at all, that I had some previous bone damage of some sort, either from a pre-existing condition, posture. I was hit by a car, and I had fallen 3 stories in my past, so we're not really sure exactly where the inciting incident came from, but I have what looks to be a pretty closely fused set of vertebrae in my cervical region, and then right next to that is one that's trying to fuse, and then I guess up and down the line I have some bone spurring above and beyond that area. And I was having numbness in the back of my neck, tingling and coldness in my hands. I was unable to really function at that point and was in horrible pain to the point where I almost really wanted to dig a hole in my own neck and tear out whatever it was that was bothering me. It felt like somebody had left a pencil or something stuck in the back of my neck.
So yeah, you were pretty much saying like, if there's a surgery, just remove what's going on, and I'll be happy.
I would have gladly signed
away
any piece of paper to have that go away if that was possible.
So then at that point, what was it I told you was going to happen, and how long it was going to take, and what to expect? What did I end up telling you? Well,
basically the beginning part of the treatment you explained was going to be some adjustment, besides just the adjustments that most people expect when they see a chiropractor. We were doing some work with a traction unit. We were also doing some exercises and some lengthening and stretching work. That's kind of like passive, using wedges, other fulcrums that actually kind of push and stretch and open up that area. And that basically you told me that to expect within, I think, about 6 weeks, around 20% or more increase in or decrease in the amount of pain that I had.
Yeah.
Decrease in symptoms, relief.
What did you end up having about that?
Basically, it was funny because it took me like 2-3 weeks. I was getting kind of frustrated. It didn't seem like things were going anywhere. And then right around the 4.5-5 week mark, things started to let go. And I would have moments, a couple hours sometimes at a time, where I didn't even think of my neck, which was really kind of a blessing. And then within a short period of time, I'm now at the point 8 weeks out where I'm feeling like doing more than I probably should be. I'm feeling really good and wanting to kind of get back into the swing of things.
Awesome. And so right now, on the worst level of pain you had with that neck, what was that at on a 1 to 10?
There were times where I was at an 8, and I'm pretty good with pain. I've managed to tolerate quite a bit of it. So for me, an 8 is quite a bit. I think by 9 or 10 and I would be gone completely.
So now regarding your neck, where are you at?
The spasm, like I said, was at about an 8. I think before the actual incident, I was living at a constant like 4, I would say. And now, after 8 weeks of being here, I'm at, I'd call it a low 2, maybe. On a hard day, if I've done some shoveling or working in the garden, I can put it back up to a 3, but right now it's not something that's on my mind.
Awesome. Is there anything else you would want anyone to know about it?
No.
No?
Okay,
Cool.
no.
Thank you.
All right.